أعوذ بالله السميع العليم من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين، وأصلي وأسلم على المبعوث رحمة للعالمين سيدنا وحبيبنا محمد صلوات الله وسلامه عليه وعلى أصحابه الغر الميامين. وبعد، تحدثنا في الحلقة الماضية عن الأمراض الشريانية، وهي الارتيريوسكليروسيس ومنها الاثيروسكليروسيس. And today we will be talking about the treatment of arteriosclerosis. Right. In the treatment of arteriosclerosis, as you know that the definition is all about the plaque that is formed in the arteries. Now we have the goal of treatment. What's our goal in the treatment? In the treatment, first we need to relieve pain. Another thing is that improving the exercise tolerance, because the patient has a problem. In the case, as you know, that we have four types of arteriosclerosis. We have coronary as well as stroke, which is the one that's caused by the carotid artery, the artery going to the brain. Another type is peripheral vascular disease. So these are the main types of arteriosclerosis. So in the treatment, our goal is to prevent pain, first thing. Another thing is to give exercise tolerance so that the patient would be able to walk easily. Because in the case of peripheral arteriosclerosis, the patient has problem in his leg and he cannot walk properly. And also prevention of cholesterol is important. So what's the treatment? The first treatment is the natural treatment. We need to do the natural treatment such as lifestyle changes. A person should change a lot of things that are related to the increasing of the disease. Things like smoking cessation. If you know, smoking cessation is the process of giving something instead of smoking. Like if the person needs a nicotine, we instead of cigarette, we give him nicotine as patches in his hands and somewhere in his body topically. So another thing is lipid lowering therapy, which is cholesterol reduces, and also control of diabetes and hypertension are important. And also very importantly, the supervised exercises. The exercises that he does should be in front of a doctor or a physician. Yeah. So what's the necessary treatment that we have to do? First thing is smoking cessation includes patches of nicotine. Another thing is physical activities, exercise, supervised exercises. Another thing is weight control. We have to control the weight of the patient. Third is diabetes control by giving the treatment of diabetes and hypertension. One of the drugs that are important are antiplatelet drugs. Antiplatelets. As you know, we have mentioned that aspirin and clopidogrel are very important antiplatelets. Then ACE inhibitors are one of the drugs that control hypertension. That's why we should give the patient ACE inhibitors, as well as most importantly, the lipid lowering drugs. Lipid lowering drugs include statins. You know, we have simvastatin, pravastatin, luvastatin, rosuvastatin, and pravastatin, right? So these are the lipid lowering drugs that should be given to the patient. In addition to supervised exercise is very important, because sometimes when the leg pain is very severe and sometimes it leads to